Hi, everyone. Brandon Truitt here with WPRI 12. We're joined by Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, we were just talking that you really have a way of breaking some things down, so we appreciate you doing this as there's a lot happening today. So thanks for being here.
My pleasure. Thanks for having me on.
Let's just start right out of the gate with what we're hearing from Pfizer. This early report of a vaccine up to 90% effective. That seems promising from my view. What do you think?
Yeah, so first of all, it is an early report. It's just a press release. We haven't seen the full data. But the bottom line is this is really good news. A vaccine that might be 90 or 90+% effective. I think it certainly surpasses my expectations. I think it surpasses the expectations most of us had. Most of us thought a vaccine might be, if we're lucky, 60 or 70% effective. But this will help a lot if the data pan out and ends up being as effective as it looks. I think it'll make a big difference in our society.
From this early report, is there anything that you're cautiously optimistic about or that concerns you that you're seeing so far?
No, and again, we just have a press release, so it's hard to do a good evaluation, but there's no evidence so far of much in the way of a safety signal or any safety problems. Again, early days, we don't have that much data yet, but so far it doesn't look like there are any safety problems. And again, it looks like the vaccine really made a pretty big difference in terms of preventing infections. If this holds up as the data becomes more, continues to come in and becomes more widely available, I think this will be a really important piece of news in terms of turning this pandemic around.
Let me ask you about a timeline. That's where a lot of our viewers are wondering, at what point from where we're at now are people getting shots in their arms? Can you explain what you know, any insight you might have on that?
Yeah, unfortunately, it's a little bit of a ways away. So the vaccine has not even gotten emergency use authorization. I suspect that will happen in the next few weeks as the data is put together and shared with the Food and Drug Administration. After an EUA, emergency use authorization, depends a little bit on how many vaccine doses Pfizer has. And my guess is it's probably millions, maybe tens of millions, but not hundreds of millions of doses. And so they'll probably start with first responders and healthcare workers. I suspect some of those people might start getting vaccinated in December and January, moving on to more high-risk individuals, older people, people with chronic disease, more like February or March. And then the rest of America, probably more like April, May. There's a lot of logistical challenges to making hundreds of millions of doses and getting it out to the American people.
And I just want to ask you about that last part there, the distribution of this. We saw really the beginning of this, a lot of states having to compete with each other for PPE. I guess my question is, will that be the case with this? Do you know how Rhode Island is set up now, given your expertise here? I was curious if you have any insight into that.
Yeah, so two things. First of all, we do not want states competing. Like, this is not the point. And look, we are the United States, and we want this distributed based on need and not based on who's got better political connections. That's not what we want. Second, in terms of Rhode Island, I think we're very well set up. We've got a new vaccine task force that the governor has put together that's going to help think about distribution and equitable distribution in our state. And my expectation is, and everything we've heard from the Biden team says that the distribution will be based not on who's well-connected or who's wealthier, but is really going to be based on need. And that every state is going to be treated equally, and there's going to be a coordinated national response. And that's obviously, in my mind, the right way to go.
You brought up the president-elect. I'll get back to that in just a second, but I do want to ask you quickly about what would you say to those who are concerned about taking a vaccine when it's rolled out? What would you say to those people?
I would say two things. First of all, we've got to see the data first. So the data is not out yet, and we shouldn't be jumping to conclusions, but we should really let science and data drive this. So if the data shows that the vaccine is safe and effective the way I suspect it will, but we don't know, we got to look at it, then I think people should have confidence in the process. And I will certainly get vaccinated. I will get my family vaccinated. Again, I'll decide those things based on data. And we want to make sure that the FDA is using data, and we want to make sure that everybody is looking at the evidence to do this. And second is, I understand hesitancy that people may still have. The scientific process so far in developing the vaccine has been terrific. It's been done with a lot of integrity. There has not been a politicization. And I want to make sure that continues. And if it does, I hope most people will feel comfortable getting vaccinated.
All right, I want to switch to the president-elect Joe Biden, who announced today a team. I saw you tweet about this. I'm assuming you're familiar with some of the people that have been on there. What do you think of the people he put on this pandemic task force? And what do you think are the first couple of things that they should get to work doing out the gate?
Yeah. So I think the team is terrific. I know not everybody, but almost everybody on the panel. And this is the A team. These are the people you'd want running a pandemic response. They're scientists, they're physicians, they're global health and public health experts. So I think it's a great team. The challenge for them is they don't have any power yet, right? They're not the president-elect is not in office. And so what this team needs to do is do two things. First, they need to figure out what can they set up now so that we can start making some progress on the pandemic before January 20th. And then the second is they need to think about what can the president-elect do the first day he is in office on January 20th. So there's quite a bit of challenges, I think, in front of them. But if I was one team that I would have to run this, it is the team that's there.
You were saying what he can do on the first day of office. Any things that you'd like to see from your viewpoint as a doctor implemented from day one?
Yeah, so I do want to see a much bigger push towards a national mask mandate. I think masks are absolutely critical in controlling this pandemic, and they're really uneven right now. So some states are doing a better job than others. I want to see more national uniform policy. The second thing where I think is going to make a big difference if the president can really pull it off is I want to see widespread ubiquitous testing. I want to see tens of millions of tests being administered every single day. It is well within our capacity to do it. The Trump administration has largely decided not to make testing widely available for the American people, and I want to see a real change in strategy from the Biden team.
My last thing for you is just a look at the big picture of where this country stands right now compared to March and April, and really what you see in the next couple of months for us.
Yeah, I think people have to hold two sets of thoughts in their mind. I mean, on one hand, we are entering the hardest part of the pandemic. I think the next 2 months are going to be very, very tough. We're going to see large outbreaks, lots of infections, lots of deaths across the country. Unless we make some very substantial changes, I believe an additional 100,000 Americans are going to die between now and Inauguration Day. That's a pretty tough couple of months ahead. I do think there's a light at the end of the tunnel, clearly. That light is shining a little bit brighter today. We've got to get through the next couple of months and keep people safe so that people can get vaccinated and get back to their lives.